Hi all, welcome to EZI Nurse, where nursing is made easy. So we have come with yet another subject, Adult Health Nursing 1, and we'll see. So in the last sessions also we have seen many questions which is important and which is certainly coming for your exam. So in this, let's see some few important questions which is going to come for your exam for 100% surety. Okay, let's start our session. So the first question is, what is this Palsy? So it's a kind of variety name, so you'll not be knowing much about it. We'll see. What's this Palsy? So it is a condition wherein that is causing a kind of sudden as well as temporary weakness, as well as one side might get the paralysis of the muscles on one of the side of the face. So this part or any of the part can be affected. So only one side of the face is getting affected. So, and why is it occurring? How is it occurring? So it is occurring due to the inflammation or the damage of the facial nerves which is there on your skin, on the surface of your face. That is the cranial nerve 7, which is controlling the muscle responsible for facial expression. So this small, just you have to write about Palsy when your question is asked for 5 marks, 10 marks. If it for 2 marks also, you can write what is the definition. You can write what's the definition, and you can write what is the cause, what is the inflammation. And here you can see a pictorial representation wherein it is a diagrammatic format, and this is Palsy and the facial nerve is getting affected. So this whole part is getting affected. The 7th facial nerve is getting affected. That is the Palsy. Simple format or simple gist about it. Coming back to the symptoms of this Palsy. So you can see a facial drooping because one side of the face is getting weakened, or the muscles is getting weakened, or one side is getting drooped. You can see that. So the most common and noticeable drooping on one side of the face, which is causing difficulty in closing the eyes or even smiling. And next you can see the loss of facial expression. So getting one side of the affection, it is difficult with the facial movements such as raising your eyebrows or smiling whenever you're seeing other person and trying to smile. It is very difficult. So that's about Palsy. And what are the causes and what are the risk factors that is being caused by the Palsy? So first one is what is the exact cause? So the exact cause is still unknown right now, but it is caused due to some common viral triggers can be seen. So that is herpes simple virus, varicella zoster virus that is causing chickenpox and shigella, then influenza virus. So the next one is the immune system dysfunction. So in immune system dysfunction, it is always thought that the immune system may attack or it can affect the facial muscles also, and it can have the following viral infection. So that can also be a kind of viral infection, and there are some risk factors because of the age. This one can be then due to pregnancy period time. Why? Because in pregnant women, particularly during their 3rd trimester, you can see this, and it can be affected in a higher range also. So the risk factor will be more. Then next one is your family history, wherein the family history of the Palsy may increase in the risk. So one person, the other persons also can get affected. It can be a kind of genetic factors also. And other conditions are people with diabetes, then respiratory infections. Example, this flu kind of things are there. So that can also, and they are also at a high risk. So from a decline stage, you can see at a high risk. So these are the causes and risk factors. Next is about the Palsy prevention, how well you can prevent it, and what is the nurse's duty wherein you have to help them. So in the prevention also, you can use it as a kind of nursing management also. So you can help them by manage how viral infection. So you have to tell them to take care and try to manage the conditions that can lead to viral infection, and such as you can see the flu, cold, sores or shigella also. Then reduce stress taking, that sometimes it can be stress related also due to some work pressure, or kind of stress management techniques also can be told to the patient how well they can treat it. And there are some facial expressions that cannot be done whenever, sometimes eyebrow lifting, smiling. So whenever these are coming, you can help them with some exercise also. So help them with kind of some exercise, how well they can be back from the Bell's palsy. So next, your question is management with the unconscious patients and patient with stroke. So this question, sometimes you feel that, okay, I'll be able to write, but there's a certain way of writing this. First, you want to know what is this unconscious patient's meaning and the patient affected with stroke. So unconscious patient, definitely, we all know that once the person will get a kind of giddiness or headache, you can see sweating, increased perception of sweating can be seen. And stroke is one side paralysis or weakness can be seen with the stroke patients. So here, how are you going to manage those kinds of patients? So unconscious and stroke are kind of serious medical. It is a kind of medical condition where they are requiring an immediate as well as a comprehensive management. This comprehensive management is something very, not a primary level, secondary level also, no, a kind of tertiary management should be given. They must be taken care well. And below are the guidelines for managing this unconscious patients and patients who have suffered with stroke. Because why this is very important for you guys is because as nursing students, you have a major role in the clinical setups. So that is why I've given here also that it is a nursing care in emergency and clinical setups. We are the one persons who are behind, or we are with these people. So we have to take care of them. So we have to know the management methods, how to take care of a stroke as well as the patients with unconscious patients. So there's an initial step to take care. So there's an ABCD approach method when we are going to meet or how to take care of an unconscious patient. That is ABCD approach is a systematic method. It is a systematic method of assessing for any kind of unconscious. So the first one is the airway. So A is standing for airway, and you are ensuring whether they are having a clear or any kind of obstruction is seen. An example, you can see vomit, foreign body, inside tongue, there is any kind of difficulties. Then if necessary, you have to perform, you have to make the person's head tilt. So you have to make the position head tilt and the chin should be up. That must be focused, and or use any kind of oropharyngeal airway, that is the OPA. And for any suspected kind of cervical spine injury, use the jaw method, that is the jaw thrust maneuver, to prevent any kind of neck movement can be tilted up, so that we have to prevent that. Then next one, B is standing for breathing, and you have to check the breathing. You have to observe, have a close vision about the observation method. You have to make the person's chest rise and feeling the breath, and you're checking that the respiratory movements are okay, the breath movements are okay, whether the person is able to take the breath well or not, how well is the SpO2 level, all this can be checked. Then administer oxygen if breathing is shallow or present. Then in case of any kind of respiratory arrest, then you have to initiate the rescue breathing, that is CPR is needed, that is cardiopulmonary resuscitation if needed, we have to give. So in breathing, you have to follow all these techniques. Next, coming to the C, that is the circulation. So we have to assess the circulatory status. You have to identify any kind of shock, and then manage any life-threatening hemorrhage. So how are you going to assess it? So check the pulse rate and quality. So whether how well the respiratory, it is between the 60 to 20 for adults. Then measure the blood pressure. So the BP must be checked. Then check for any signs of shock, such as pale skin, cold extremities, or weak pulses is seen or not. Then look for any kind of external bleeding is there within the body or within the person. Are you able to see any kind of external bleedings? And we have to control immediately. Example, using direct pressure onto the person or kind of tourniquets that is used for IV injections. So these are the kind of things that you have to keep an eye on the circulation. Next, what are the interventions? So why are we doing and what are the interventions? If the patient is in shock, we have to give the IV fluids, that is crystalloids, like normal saline can be given to the patient, or even ringer lactates, that is containing of sugar. Then for severe hemorrhage, try to control the bleeding. So as we have mentioned before, you can have a direct pressure onto the person's chest or wherever the bleeding is happening. Then can consider the vasopressors if the patient's blood pressure is remaining low. So these are the things that you have to take care in all this circulation breathing methods. So we have seen airway, breathing, circulation. So next we'll see the disability. So D stands for disability, wherein what is the main purpose of this, or main idea about this, is to perform a quick neurological assessment. So we have to be so quick enough to handle these kinds of patients, because they need, so in the beginning we have seen a comprehensive management. So this is the comprehensive management. So D is the disability. So the neurological assessment should be checked. So how are you going to assess this? That is the Glasgow scale. So it is determining the patient's eye, verbal responses, then motor responses to determine the GCS score. And next you will see the pupillary score. Check kind of any abnormalities in pupil size, reaction to light, whether is it fixed or if the person's eyes is getting dilated. All these things should be checked on. Then check for any kind of neurological deficits like weakness is there, paralysis is there, numbness, speech difficulties. So these are the things that you have to have a check on. So that is first one, weakness, paralysis, numbness, speech difficulties. Next, moving to the glucose level, how well the glucose level is maintained. So hypoglycemic can mimic the neurological symptoms. And next, the blood glucose level should be done very properly and early it should be diagnosed. So that is D, that is disability. And what are these interventions? Why are we giving this Glasgow scale? So that is for it is very low, or there are some neurological concerns. If any kind of neurological concerns, you are intubating the patient for airway protection. Then next, treat underlying causes. Example, you have to administer the glucose level. If the sugar level is drooping down, you have to see that. Hypoxia should be maintained. Seizures, whether the person is getting seizures immediately, how you have to take care about that. So all these things must be maintained. Next, coming to the last one, that is E, that is the exposure. So the goal is to expose the patient fully. You have to assess for any kind of hidden injuries, any kind of infections is there, any kind of other underlying causes is there to the patient or not. In E, that is the exposure, in emergency cases, we have to find it out. And how are you going to assess it? So that's an important thing. Remove clothing to inspect any kind of any hidden injuries. Like example, it might be any trauma cases, rashes, bruising or lacerations can be seen. Next, check for the signs of infection. So sometimes it can be fever, redness can be observed. So normal things must be checked on, or any kind of swelling, edema can be seen. Then be cautious of hypothermia, whether the temperature is becoming very less, especially in trauma cases or patients who have been exposed to any kind of cold environment. So that should be also maintained. So this is the way you are going to inspect, or this is how we are going to treat the patient with in E condition, that is the exposure. So A, B, C, D, E. So we have seen airway, airway, breathing, circulation. D is disability, E is exposure. Then interventions, why are we doing all this and why? What is the goodness that can be seen in the patient? Once the patient is exposed, then you are going to cover them with blankets to prevent any kind of heat loss, or as well as to maintain their normothermia. And we have to consider the environmental factors like hypothermia. So all this should be taken care by us, and even hyperthermia, and provide appropriate treatments, appropriate care must be given. And example, that is what here you can see, warming the blankets, any kind of cooling measures according to the condition of the patient. If it is hypothermia, we have to do that way. Hyperthermia, we have to see in that manner. So in this way, we are seeing the one's condition, then acting appropriately. The care must be given in that manner. So this is all about the management of conscious, unconscious patients and the managementary methods, how to take care of a stroke patient. Next, we are coming to hematuria. That is also very important. 5 markers that is going to definitely come for your exam. So hematuria is the presence of the blood in urine. So whenever hematuria is coming, remember of the presence of blood in urine. And you can see symptoms can be underlying conditions. For nursing students, for you students, that is the key aspect of hematuria is you have to know its assessment, you should know about the diagnosis and the patient care. So in this you should follow when it is coming to your clinical setup also. So the definition goes like this: hematuria is the presence of red blood cells in the urine, and it can be gross, that is visible, microscopic, detected under microscope. This whole, if you are remembering, at least this definition is a very important definition. Then this can also be seen in gross as well as microscopic. At least if you know this, it is well and good. You can use all this until the hematuria to underlying conditions. That's also your key reference. You can write in your exam. Moving forward, in this benignant prostate hyperplasia, that you have to know its small definitions, okay? So that is 2 markers can be there. So it is the enlargement of prostate gland in men's. It is usually seen in men's and it can lead to hematuria. And next, that is the urinary tract infections. So infections in urinary system can also lead to hematuria. Kidney stones, that is the stone movement, as well as some irritations of the urinary tract can cause bleeding. So these are the causes of getting hematuria. So kidney stone might be one of your reason, or BPH will be one of your reason, kidney stones, then bladder or kidney cancer also. That is a kind of malignancies in the bladder or kidney may be present in hematuria. So these are the causes that you can see in hematuria. Next one is also the trauma, wherein it is the injury in the kidneys and the bladder or urethra, wherein it can cause a kind of bleeding will be more. Then moving to the nursing management. So we have to be well thorough with this nursing management. It is beneficial for your theory exam as well as in your clinical setups also. Okay, so we have to treat, or how we are going to monitor their vital signs by having a regular blood pressure checkup, as well as the heart rate should be maintained because it is in the blood. So hematuria, it is connected to blood in urine, so that should not be becoming down. And assess the urine output. How well is the color of it, what is the order of the urine, and what is present in the blood, whether urine is present or whether the blood is present in urine. Then we have to encourage the person. If the person is affected with hematuria, you have to encourage them to take fluid more, like juices. You can ask them to drink a plenty of water. So 8 or 10 liters of water must be drink, and even the fruits like pomegranates must be intaked more. Then administer any kinds of medications, like some prescribed medications will be, so that must be taken. That is for UTI, any kind of analgesics also will be given to the patient. Then patient education. Patient education is a very important thing. So we have to educate. Some illiterate people will be definitely there. They will not be having an idea about what is this hematuria. We have to make them understand in their simple language, so they are going to understand it. Then monitor all the kinds of lab results, especially this lab results will be like how well is your potassium level, sodium level, how well is your HP level, all these things should be monitored well. So these are the nursing managements that you have to take care. Next, moving to a very definite question that is coming for your exam, that is osteoporosis. So osteoporosis, when it is coming, think or remember suddenly that it is something related to your bone. So that is coming your conclusion, but don't jump into your conclusion. We'll see that definition of osteoporosis is a kind of metabolic bone disease. So that's your metabolic bone disease, so which is in the bold letters. That is your main important key point, wherein where the bone density as well as the quality is getting reduced and the bone is getting fragile. So they are weak. Fragile is weak and they prone to get fracture. So that is osteoporosis, and it is often referred to as a silent disease. Why? Because it is a progress without symptoms and until that is leading to a fracture. So that fracture can occur, so that is a silent disease. So this, at least if you write, you're getting your 1.5 to 2 marks is in your hand already. Then coming to this pathophysiology, there's an imbalance between the bone rest portion as well as the bone formation. That is osteoclasts, that is the bone reabsorbing cells, which is leading to the bone thinning and the fracture is at a risk. Then the bone lose calcium, phosphate as well as collagen and they are getting weakened. So that's your second point. Coming to your third point, wherein there are common sites of getting fracture, that is including your spine, hips and wrist. So there are some regions which is getting this osteoporosis. So that is your spine, hip and wrist. So remember that, connect it with some stories, remember it with some mnemonics that is making you feel, okay, I will remember this in exam. That way you are going to relate it. So think if sometime, okay, how I can write this exam if osteoporosis is coming for your exam. Remember like a story wherein, or if any incident has happened in your own homes. Sometimes definitely osteoporosis and all is a kind of common disorders which is seen nowadays. So if it is something related to your home, remember if a girl or a boy is affected with osteoporosis, it is seen mostly in your hip, wrist or the ankles. So that can be one of your point. Next, it is a kind of metabolic bone disease and it is getting prone to get a fracture, and it is a kind of silent disease because, or it is progressing without any kind of symptoms. Symptoms cannot be seen, or sometimes even pain also cannot be felt. So that is getting or leading into the fracture. So this way you're going to structure your whole osteoporosis and it is easy for you. Okay, coming back to our topic. Once after that, nursing management is very important. Assess for any kind of risk factor. Go through your assessment. All the assessments should be kept in your mind. How is the family history? How is the lifestyle factors? How well they are maintaining their diet? Then exercise, quitting of smoking. What is their medical history? Past medical history. All these things should have a check. Then coming to the patient education, teach about the importance of the calcium and vitamin D intake, because nowadays it is becoming very common thing that the calcium and vitamin D intake is very less in the current scenario. Why? Because the people are getting a sedentary lifestyle. No one is coming out of their home. They're always sitting and using all their technical gadgets that can be seen nowadays. So we have to teach the importance of the calcium, vitamin D intake. So that can be taken. Vitamin D is sunlight exposure. That is nowadays very difficult for the people to get up in the morning, but we have to teach the importance. So from the child itself, when the child is getting a exposure to sunlight, the vitamin D is automatically getting into the body. Then encourage exercise and fall prevention strategies. So teach them kind of techniques that can be used. Advice on medication, how well the proper administration of medications can be used. That is the biophosphonates. Then what are the potential side effects once you're taking all these medications. Teach them that. Promote weight bearing activities for bone strength. So sometimes there might be the obese patient, we have to tell what are the difficulties, what are the disadvantages, help them also, then promote weight bearing activities and giving them the bone strength. Then monitor for any complication, check whether the person is having any kind of fractures, especially in high risk, that is especially in the spines and hips. Then educate about proper body mechanism to avoid any kind of vertebral fractures. Then fall risk assessment, and you have to even encourage the compliance with prescribed treatment and lifestyle techniques that are very good for their improving their bone health. So this is about the nursing management with osteoporosis. Next, coming to a pertussis, a very important condition. So that pertussis, it is also known as whooping cough. Even you have seen in your community health nursing also. This is seen even in AHN 1. So pertussis is also known as whooping cough. That is, it is a kind of highly contagious respiratory distress that is seen commonly among all the kind of children, even sometimes even seen in adults, and which is caused by the bacterium Bordetella pertussis, and it is characterized by severe coughing, that is coughing fits, that is making the difficult or the patient is unable to breathe, or he or she will be unable to breathe when the pertussis or whooping cough is being caught by them. So there's a proper definition for that you have to write in your exam. So pertussis, it is a acute bacterial infection that is seen especially in your upper respiratory tract. So this upper respiratory tract is a main important key point, where it is commonly even known as whooping cough due to the distinct whooping sound made by during the coughing. You can see that sound which has been made by the patients. And etiology, so this is caused by this Bordetella pertussis, that is a gram-negative bacteria, and the infection is transmitted, or it is getting transmitted through the respiratory droplets, especially if the two persons are in a mass, or whenever it is in a huge crowd. We can see there can be a respiratory droplets wherein the infected person is getting coughing, sneezing, talking. All these methods are being transmitted. Then what is this nursing management? You have to assess the respiratory status, monitor the SpO2 level, that is oxygen saturation rate, and work of the breathing, especially how well the breathing is done, especially in the infants and those with severe symptoms. Then you have to administer all kind of proper antibiotics, then monitor for any kind of complications, provide comfort measures so that you can give your comfort devices like pillows can be given. Then frequent dehydration also can be seen, so that proper water also should be taken care, and encourage them to take a well rest. Encourage the patients to take maximum rest. Then patient education. So as every time mentioned, the persons or the sometimes people will not be knowing more about all these kinds of disease condition. As nurses or even in your student period life, we can make them understand what is this disease condition. Take your own initiative, go to them, talk to them what are the different disease condition, but have a proper knowledge and go talk to the people out there. So this is all about your nursing management. If you are writing in a box type also, it will be well and good. You can mention the main points and you can give your explanations. So next, let's see about the perioperative nursing. So what is this perioperative nursing? So there's a standard for definition of perioperative nursing. It is mainly involving or it is also providing the patients before and as well as after the surgery. So that is perioperative nursing, and it is including pre-op also, then intraoperative and post-operative. So three phases can be seen. So preoperative, intraoperative and postoperative. So the role of perioperative is a very crucial, wherein the before the post phases also can be seen, that is the pre-op also, intra-op also. and it is an advocate for the patient's safety, and it is also managing the anesthesia side sector is also maintained, the infections, and you're providing education and you're ensuring the patient's recovery. So this whole is constituting a definition for perioperative nursing. So everything must be mentioned while you're writing your exam. So this is covering or fetching you 2 marks completely. Then moving to the phases of perioperative. So in the last definition only we have seen that the perioperative, intraoperative and postoperative. So pre-op means it is beginning with the patient is scheduled for the surgery, and once he is entering into the OP, that is your operating room. So that is your pre-operative nursing. And intraoperative during the phase of surgery, or when the patient is entering into the operation theatre, and once the procedure is begin or the surgery is begin, and once he is getting transferred to the PACU. So that's your intraoperative phase. Then last, coming to the post-operative phase, it is starting when the patient is getting admitted to PACU, and it is ending where every procedure ending and it is fully recovered and discharged. So this whole process is constituting the post-operative phase. All the 3 phases is also included in the last phase. Then there's a special consideration for the pediatric patients, geriatric patient, obese patients and patients with disability. So with all your key headings only you're understanding the meaning, wherein pediatric patient, it is tailoring or it is consisting of the patients with the younger patients, including appropriate sedation will be given, and even also the family involvement is seen in this. And geriatric patient, especially you're seeing the extra caution due to sometimes of there is lot of comorbidities. In the morbidities you can see the comorbidities alter during the metabolism, and as well as you can see the frailty. Then coming to the obese patient, that is a kind of special consideration given to wound healing patients, especially the gangrene patients and all is wound healing. Then anesthesia dosing and positioning is all well maintained for this obese patient. Then patients with disability. So you're considering the disability of the patient and you're acting, and the care will be given in that manner, and the communicative supporting system is also given to those patients. Next, it is the last one, that is cancer of cervix. In cancer of cervix, here you can see the cervical cancer, that is your pictorial representation, and the cervical cancer, it is beginning of the cells, especially the cancer state. It is beginning within your cervix, where the uterus is connecting it to the vagina, and it is usually developing in the slow manner over the time with precancerous changes, and it is a progression in the full-blown cancer. So this is a small definition of cervical cancer. So how you can remember this? You can start from this and end until vagina, make it as your 1 point, then come with the how well it is getting caused and just end it. So this is a cervical cancer. This can be asked for your 2 marks, and if you are able to draw the diagram, it is well and good. So hope you have understood the session, and we have discussed the important questions in the last 2 sessions. Hope you have understood. We'll meet again. Till then, keep learning, keep enjoying with EZI Nurse. Thank you all.